My name is Convict Craig. Combat Craig is taking a break today. Somebody found their way into the costume section at Walmart. 582213. That's me. VA sleep study tips. What to expect, what happens, how to prep. If you want to learn more about the sleep apnea process and the VA claims process, check out Combat Craig's bootcamp at combatcraig.com. Before you can get a sleep apnea 50% rating, you're going to need to complete a VA sleep apnea test. You can get it done at a private doctor, but this test is good enough to do at the VA. So you need to pass the means test. Then you need to go to the sleep study. That's not a pass or fail one. And you'll either have sleep apnea or you won't. So if you don't have sleep apnea and you're not prescribed a CPAP machine, then no 50% sleep apnea rating from the VA for you. I would like to thank the sponsor of today's video, Hill & Ponton out of Orlando, Florida. They're VA accredited lawyers, and they might be able to help you with your VA claim. Check them out at hillandponton.com. The reason why sleep apnea claims are hard to win sometimes is the medical evidence. So it's easy to pass the means test, get the sleep study, get the diagnosis of sleep apnea, and get the CPAP machine. It's the nexus that catches people up. So the VA is probably going to give you two options. You can do the at-home test, or you can go into one of the sleep centers like I did. Go to the sleep center. You're going to get a lot more data out of there, and they're sitting there watching you sleep, and you're hooked up to probes differently. I mean, if the at-home test is all you could do, then do that, but try to go to the sleep center. Think about the other side of this on the claim. If you're going to file a claim for sleep apnea, you're going to need a private doctor to write you a nexus. Give them as much info as you possibly can. Yeah, I'm filing it sleep apnea secondary to PTSD. Here's the results of the sleep study. Here's all my PTSD symptoms. Give him some meat on the bone to work with so he can, craft a good nexus for you. I think the hardest part is finding the doctor to write you a nexus. They're out there, but that's probably the hardest part. And then winning the claim, obviously. But up front, how do I get a sleep study?